Hi, I'm Niall. I'm a young person who's used the services at 42nd Street, and today I'll be speaking with Alex.
Hi, my name's Alex. I'm a service manager in the counselling and therapy team. I'm also a CBT therapist, and I'm going to be talking about CBT, which stands for Cognitive Behavioural Therapy.
Who is this service for and who could it benefit?
Okay, so CBT can be beneficial to lots of different people with lots of different difficulties, but it can be particularly helpful for people who experience problems with anxiety or depression. CBT is a talking therapy, so it relies on somebody being in a place where they feel comfortable to talk about the things that are difficult for them. Like all therapy, it can be challenging, so it also relies on somebody having a certain amount of energy and motivation to kind of try different things and experiment with different ways of thinking and behaving. But the important thing to remember is that the therapist's job is to support you through that process. And if it is difficult, if it is challenging, then it's the therapist's job to support you to make sure it's going at a pace that feels comfortable for you.
So Alex, what can a young person expect from the service?
So from CBT, in terms of what to expect, usually CBT would be between something like 12 and 20 sessions, which is usually weekly sessions of therapy. It can be fewer than that. For some people, just 6 weeks might be enough. So if you think of that in practice, that could be with holidays and things like that. We're thinking of anything from 3 to 6 months, but for some people it could be as little as 6 weeks. So in terms of how a CBT session might look, sessions will usually be either 60 minutes or sometimes 90 minutes, depending on how much you want to fit in. A session will usually start with the therapist asking somebody how they'd like to use the time, so what they'd like to focus on in that session. CBT stands for Cognitive Behavioural Therapy. Cognitive means about thoughts, behavioural obviously about behaviour. And in CBT, you're going to be exploring the connections between your thoughts, feelings and behaviours and trying to identify any unhelpful patterns that there might be. CBT is a little different to some other kinds of therapy where you might spend some time really exploring your history and what the origins of your problems might be. In CBT, we focus much more on the here and now and what are the things that might be maintaining somebody's problem. So once we've identified any patterns, then we'll work together to experiment with different ways of thinking, different ways of behaving, and hopefully develop more helpful, kind of healthy strategies to move forward with. And at the moment, CBT is available in Manchester for anyone aged 13 to 25.
So Alex, what happens after the service ends?
So a lot of people worry about their therapy coming to an end. I think particularly when therapy's been useful, people think about, kind of how am I going to manage without the therapist? But it's actually a really important part of the process. So we make sure we devote at least the last couple of sessions to thinking about ending and also planning what we call relapse prevention. So unfortunately, it's a reality that a lot of people who have therapy, even when the therapy's been really helpful, it's very common that they'll experience similar difficulties further down the line. So we spend a couple of sessions thinking about what are some of the things from the therapy that have been most helpful. We review some of the key themes. We think about what they've learned from the therapy that can be useful to them in the future. And the example we often use with young people is thinking about learning to ride a bike. So when you're learning to ride a bike, I guess the therapist might be alongside you, kind of gently holding the bike and supporting you. But there's that really important moment where the therapist steps away and you get the opportunity to realise that you can manage on your own, that you can cycle. But of course, it's important to keep pedalling.